Yeah, hi, this is Joe on yet another one of our back road to the White House stops. Today we're in Athens, Georgia, home of the University of Georgia Bulldog. Also, it is the home of Dr. Jonathan Davis. Dr. Davis is a graduate of Covenant College in Lookout Mountain, Tennessee. He did his residency at a community health center in Appalachia. He now works as an ER doc in rural Georgia and volunteers time at the Mercy Health Center in Athens each month. As the healthcare debate grinds on in D.C., we've decided to take the debate to this tremendously common sense small-town doctor. The kind of doctor, in fact, that our administration would consider for Secretary of Health. Although Jonathan hasn't agreed to that
Jonathan
yet.
has not agreed to that, but...
Hi, Jonathan.
Hi, Joe.
Okay.
Good to have you here.
Yeah, it's good to be here, Jonathan.
All right.
All right, during our conversation, Jonathan, earlier today, you suggested that we have become a society that's way over-medicated. And a society that, as a whole, is making too many trips to the doctor. Can you tell us more about that?
Yeah, I think that is really something that's partially our fault as physicians. I think that because we're successful in treating a lot of diseases, I think that people tend to forget that our own bodies do a lot of the work of healing us when we're injured, when we're sick. A lot of minor things probably don't need medical care, but we've sort of made people dependent on us so that they think that they need to come see us for colds, runny nose, bruises, these sorts of things. And because the cost of medical care, and we sort of spread those costs around, coming in to see us, even sometimes for little things, people come into the hospital for bruises, bumps, colds, low-grade fevers, things like this, that their bodies really are doing their job fixing it, but they're not quite at the state. But people don't recognize those things. And it's partially our job as physicians to do a better job educating on those sorts of things. Because I think a lot of healthcare dollars are wasted on things that actually heal on their own. We have wonderful immune systems that fix a lot of stuff.
Well, as a follow-up to that, Jonathan, percentage-wise, and I know it's hard to quantify, but if people stopped coming for some of these minor things that really did need to be looked at, what percentage would go away as far as healthcare costs in the country? Can you give me a ballpark on what that might be?
Now, as I said, I'm not a Secretary of Health kind of guy, nor am I anyone who studies the percentages. Yeah. In my experience, just ballparking based on what I see, 30% perhaps of healthcare is on things that aren't necessary. We do a lot of unnecessary care in this country, and you hear it talked about a lot, but the difficult thing is how to identify it, and part of it is educating people so that they know that you don't need to see a doctor for every physical discomfort.
So translated, that would be billions of dollars that we're perhaps overspending on healthcare. Okay. Another thing, Jonathan, you volunteer at a rather unique health center, which we toured today. Can you explain a little bit about the center?
Sure. Mercy Health Center was started, I think, about 10 years ago in the community by churches, several churches, including the church that I attend, that really just wanted to get involved in the community and help out our neighbors, and that's what we wanted to do. And it's done on a completely volunteer basis, volunteer physicians, volunteer staff, volunteer nurses, volunteer counselors, everything. And this clinic was actually built by volunteers who had worked. Initially, it was in a much smaller place, I think in a storefront, and then they built this clinic, volunteers, and we really have served thousands of patients at this point with free medical care, which is really cool.
I remember reading today in the fact sheet that last year alone there was over 5,000 visits at Mercy Health Center. Okay, instead of creating more centralized bureaucracy in D.C. with the current healthcare proposal, our administration would push for a regional healthcare system as a throwback to the old days where local people were, well, helping local people more. What's your take on that? You think that would work?
I think it would. I have a I think it is something where on a national level we should be helping our neighbors on a larger scale. But one of the things that happens within bureaucracy is it just gets big and heavy, and I have seen healthcare bureaucracy that just doesn't understand what it's doing, because it's the people who are making the big decisions are not connected to the people they're taking care of. And one thing that I had a friend who recommended, and interestingly, when I read your platform, you're one of the few people who's ever said anything about this, is that healthcare should be administered on a local level. I think that there should be large organizations like the National Institute of Health and the CDC that help guide, give information, collect data, make recommendations. But in a lot of ways, it strikes me that something like the school systems, when we look at the school systems, it's mandated that we're all going to help educate children. It's something that we're involved in. It's something that we pay taxes for. But the way the decisions are made are on a local level. The national government makes recommendations. They do national studies on what works and doesn't work in healthcare. But really, the people that are making the individual decisions about the schools are a school board. That's all people that live in the local area who've either been through the schools or had children in the schools, and their neighbors elect them to look at these things, sit down and make decisions. And I think that that local people getting involved with helping direct, they take all the data, but also they know the community and are able to really say, this is what would work in our community and this wouldn't. And I think that would be a really neat thing to see in healthcare.
Yeah, well, that's excellent, actually. I think that would work. Anything else you want to add that we haven't touched? I'm sure there's a whole gamut of things we haven't touched on, but
yeah. I would like to say that I'm just very pleased to have Joe Schriner here in our home, and that I've spent a long time voting for Republicans and Democrats, and I know Joe's a long shot, but I've really been impressed with him. And having a chance, I voted for him in 2008, having a chance to actually meet you and talk to you, I'm very impressed. So, thank you.
Well, thanks, Jeff. I appreciate the endorsement. If I could add an addendum just for the people in Georgia who might be watching this, we make it a point, Jonathan, not to pander to anyone, but in this particular case, the people of Georgia need to know that when we get to D.C., the national symbol is going to change from an eagle to a bulldog.
I don't think that would go over well, Joe.